What is asthma? During breath, air inhaled throughout mouth and enter the respiratory passage. Then air passes throughout the trachea and split into the bronchioles, and finally enter the tiny sacs called alveoli, where the exchange of gases take place. Asthma is a disorder of obstruction breathing due to inflammation and narrowing of bronchial tube. Initially, bronchial tube become inflamed and process thick mucus. Later, mucus surrounding this arrowing tightening and air cannot move freely, causes bronchospasm, results shortness of breathing, and air moving throughout the tightened airway causing a whistling sound known as wheezing. As just we have discussed, symptoms of asthma are persistent cough, dyspnea, wheezing, chest tightness. Symptoms and severity can change over time and may not have all the above symptoms all time. Classification. Asthma can be divided into two groups: allergic, which known as atopic, and non-allergic, which known as endogenic. Host factors include genetic, gender, and obesity. Let's give a look for factors that influence asthma attack. They are pollens, pet dander, weather changes, tobacco smoking, and etc. can trigger and worsen asthma symptoms. Diagnostic methods include history and pattern of symptoms, spirometry, peak expiratory flow, and wear. Spirometry measures how fast and how much air you breathe out. Differential diagnostics. Mostly asthma and COPD are having similar symptoms which can make you confused. So here is a table which can show you differential points for differentiate asthma and COPD. Plus we are having one more test which we call salbutamol and aspirin test, in which we check forced expiratory volume of patient. Then we give patient salbutamol. Then again we check forced expiratory volume FEV. If it become normal, then it's asthma. And same thing we do with aspirin. Let's give a look to treatment. Main thing about asthma treatment is asthma can't be cured. We manage it by using medications and trigger avoidance. Asthma affects 300 million people globally every year, and about 250,000 people die of asthma permanently around the world. There are three stages for asthma attack: mild, moderate, and 250,000 number of people who still die because of asthma, so it's a huge amount of number. So what we should do if asthma attack comes unexpectedly? In mild attack, first of all we should see first step in helping asthma. We should determine the stage of attack. When someone is having asthma attack, his chest may feel tightened but not enough to cause difficulty in breathing. The asthmatic will appear to be fine, speaking easily and fluently. In second stage intervention, sequence of intervention stage vary depending upon the asthmatic, how he is feeling, the circumstances surrounding attack. For example, if not just feel triggered from the attack, person may first open the window or go outside for fresh air. On the other hand, where coughing is triggered, the asthmatic will be more inclined to first drink water. If symptoms continue, drinking water during asthma. Water is just as important as taking medication. Adults and child under age of 10 should drink two huge glasses of water consequently before taking medication. It's important that water is warm like room temperature, at least room temperature, because drinking cold water will constrict the airways and make the asthma attack worse. If symptoms proceed after 15 minutes, drink 2 more cups of water, and if available, take prescribed medication. If no medication is available, then percolated coffee is available. Then drink 2 cups of coffee using instant or freeze-dried coffee. In next step, let's go for a reflexology, applying reflexology. What is reflexology? So it is a healing art that promotes health and prevent illness. Every part of a body has a reflexology site on a foot. While applying reflexology, we should use the tip of the thumb. Apply pressure on the side of each foot. Press each side for the 15 seconds repeatedly. Apply pressure at that level until your pain goes, and socks can be left over on. Medications, we use both rapid and short acting inhaled beta-2 agonist. Example of rapid is salbutamol, albuterol, and for long is formoterol, plus systematic glucocorticosteroid, anticholinergic, and thiophyllene. For prevention, determine the initial level of control of implements treatment and maintain control once treatment had been implemented.